Now, in conclusion, we also know that as part of all this economic hardships and development, we've had concerns being raised by leaders of health worker unions saying that there's been extreme brain drain within the industry, leading to 4,000 nurses leaving just within the first half, and in excess still applying to go. And it's all because of the difficulties the economy is facing. How do we reverse that?
Yeah, thank you. Just a quick one, just to make some.
Yes, and then you make that point and then we'll quickly move on.
Yes. The NPP keep making this argument that the external factors, Ukraine, war, and all of that. We must first ask ourselves, the neighboring countries surrounding Ukraine, how are they faring? Poland, Hungary, Romania, Russia, all those countries bordering Ukraine. How are they faring? Such that we in Ghana, very far away from Ukraine, always put our problem to Ukraine. The COVID-19 levy, the Auditor General report clearly point out evidence of corruption. The NPP government has failed in the management of this country. Is it the Ukraine war, or is it those engaged in the Ukraine war that has come to kind of utilize the funds we derive from the COVID-19 levy? So why do they always put everything on the Ukraine war? China that suffered the highest loss. When we talk about this COVID, it started from China. What is their GDP now? $17.3 trillion US dollars. We all know that GDP is the total value of the finished goods and services produced within a specific period of time. So why do the NPP keep blaming the Ukraine war, COVID, and all of that? We are still paying COVID-19 levy, even after COVID. We are still paying. Your own auditor's report, not Domlevo's report, the NPP's own Auditor General's own reports, I cited them. We are talking about the nurses. We must first refer to the nurses to patient ratio. It's quite unfortunate that in spite that we are performing badly, if you look at the nurses to patient ratio, more nurses are leaving this country. If you take Florida, for example, nurses to patient ratio in Florida is 1 to 44. In Ghana, it's 1 to about 800. One nurse is to 800. So if you have this ratio and you have Ghanaians leaving, nurses living out of Ghana, it will make it worse. But can you blame these nurses? Every 3 months, this government increased prices of electricity and water every 3 months. These are facts. The income level, and because of the inflation, we all know that inflation reduces the purchasing power. The income levy of the nurses remains the same. So most of them, understandably, will travel out of the country. As a result of this IMF engagement, the wage bill have been reduced by 0.4% of our GDP. So it's quite unfortunate that nurses are leaving the country. But it's understandable looking at how indisciplined the NPP has been in managing the economy. Thank you.
Lajanto, how do we stem this tide? If you look at the magnitude, the numbers that are leaving in their droves.
Look, when you go to the literature you sent to us,
yes,
and you read what it says.
From the Ghana Registered Nurses, as well as the Workers' Union.
There's a lady in there who says, called Madame Ofori Ampofo. And she has indicated that nurses want an environment that would help them in their career progression, further studies, and also better salaries and remuneration. Hence their decision to travel outside the country to pursue these interests. And most of the nurses that are leaving are the experienced ones, the ones who would train the young ones to come in. Look, health, nobody can tell you when you're going to get sick or when you're not going to get sick. It's a key feature in life, being healthy or being unhealthy. So we need our health personnel. Now, if they are going in droves, what are we doing about it to stave it? What are we doing about it? Whose responsibility is it? It is one area where the employment of nurses is the government's responsibility. Hospitals. Hospitals. What are hospitals there for? To treat sick people. And if you don't have the personnel to treat the sick people, are people not going to die? And so something really should be done about it. What is government doing about it? The Minister of Health came to tell us that nurses are leaving in their droves. We can't stop them. So what are you putting in place to stop it happening? Remember, it's the taxpayers' money that's used to train these nurses. So what are you doing? What is the environment? It all boils down to the economy, doesn't it? It all boils down to the economy. How vibrant the economy is. And even when the economy is vibrant, what are you doing to make sure that they are taken care of? When you point a finger at government, you are told because it doesn't get contract, you are against government. How ludicrous. How ludicrous was such a statement? And I ask the question, if what my brother was saying is right, why are the flag bearers not touting the same thing? What is it? Why are they not touting the same? Why are they not saying the same thing? Something is wrong somewhere, and it has to be taken on board. I would have thought at this point, the president, if for nothing at all, would see where the trajectory of his flag bearers are going, and he will start doing something about it. People are not happy in this country. People are not happy in this country. Thank God that this year, the rains haven't caused massive flooding. Thank God. But the rains haven't stopped. And if it happens, you know, when your house gets flooded, do you know the impact on you? Do you know the impact on you? Especially when you feel you've put a government in place and nothing is happening. And my brother keeps talking about, and when we came, this government did this. When we came, this government did this. There's something called perpetual succession, isn't there? You come in, assets and liabilities, you take and make it better. So why do we keep referring to what the old government did? Their time is gone and past. Solve what is there today. And look at our nurses. Look at our nurses. Did they not stay home for quite some time? Have we been able to consume all of them? Other countries would take them. Other countries would take our fine brains. They will take it to make their country better. The same mistake we've made, and I'll call it a mistake. People will say it's a commercial thing. But the same mistake we've made, we've allowed a Chinese company to come and set up a refinery next to our own. And you know what they are saying? They are not going to do this kind of thing we do. Bulk. If you have your tanker and you want a refined petroleum, bring your tanker. We'll put it in your tanker and go and sell. What is that doing to our own? Is it not breaking our own? Yes. It's not breaking our own.
And you're saying that as a nation, we've allowed it.
We've allowed it to happen.
There's no level of protectionism.
No protectionism. And what have we done to our own tour? What have we done? These are some of the things that you sit and you look. You came, things were broken. Have you been able to make sure that it is going on? Trade fair. What have they done to trade fair? Did they not break the whole place down? Where is it today? They are now telling us between 3 and 5 years. Where? And so, if nurses, if teachers, and look, if it so happened that the teachers we have today were like the teachers we had in the First Republic, they would all have left. They would all have left, but they have nowhere to go to. And that is the frustration in this country, that you're in your own country and there is no way for you to do anything. You feel you're in a straitjacket, and the powers that be are doing nothing to help. How many times has the finance minister come to tell Ghanaians, look, things are very, very difficult, but we will make sure that this added value thing we say we will do it. Yes, taxes are something that we need. However, there are certain taxes that put pressure on you. We will try and release it small. Have they said anything like that? Have they? And wasn't it 2019 that the World Bank was warning us about our loans? Was it 2019? Was COVID there? COVID wasn't there. So what are we talking about? What are we actually talking about?
About our mountain debt, yes. Because we're going to
what you call it.
Right.
Look, I'm not in this fight to castigate. I'm in this fight to find solutions. They should tell us what is the solution. Let us all debate the solution and let's see how we move forward to bring the country back to where it is. It is not a partisan thing. We should stop the partisan thing. It's not helping. It hasn't helped. Let's find solutions. Be it whether the government did well, let's find the solutions. We are all in the guagragra together. Country no broke, country no broke. Are we not all inside?
Yeah, we are. Now, Jamaluddin, how do we stem the tide of the brain drain in the health sector?
Well, the brain drain issue has been a concern over in recent times and even across West Africa, because I remember watching the news in Nigeria where the former health minister then was talking about putting measures in place, some of them proposing a 5-year mandatory stay within the country after doctors and nurses complete their training and are deployed. When my co-panelists were making their submissions to, I read a couple of stuff online, and I came across this too. Nigerian health authorities worried about exodus of doctors and nurses. Ghana also have similar concerns. I've heard, is it the Osaji for Ambotio for opinion? In recent times, one of the chiefs, traditional rulers, also spoke about the issue in recent times.
I think it was Otumfo.
It's Rado Otumfo. Thank you. So, yes, we are losing them. And when I did a couple of conversations outside with some nurses, I'm told those that go to the nursing training only have 2 years to serve, mandatory 2 years to serve. And there are issues. There are issues that must be addressed. Some of the issues are numerations, which involve internal structures by even certain hospitals. Externally too, there's a need to create certain bonuses and allowance to motivate staffs. I'm told at the regional hospital here at Rich, if you're staff there, you get free healthcare, your spouses and your family, immediate family equally get free healthcare. But
At Rage?
that is what I've been told. But at a different hospital, which is quite bigger than Rich, which I wouldn't want to mention the name, do not have those arrangements. You see, we need to create those platforms. Even if you have to put your staff on a special health insurance package to ensure that settings, if I'm working in the country or I'm working at a certain hospital and I know that when there's an emergency and I have to go into a surgery, my services to the facility and the country covers that, I'll be proud. I'll be proud to work.
As part of the incentives to stay.
Yes, you need to insensitize people. You need to motivate people to stay. So we should look at it in a bigger perspective, find ways to bring out measures or to bring out certain numerations for this professional health workers and find a way of keeping them around.
Okay.
Because if the working environment is conducive and you have peace of mind, you would stay.
Certainly.
I have been fortunate enough to live outside, and I can tell you, it is not easy outside there.
Is that why you came? Because it's not easy.
It is not easy outside there. In as much as you work, look, sometimes it is like depression. You wake up and your only friend is the four corners of your room. You have to, if you are going to school, you go to school, you go to work, and you only come back. And the time you call Ghana to, they are asleep. So it's not easy.
That is if you live in the US. If you live in the UK, the time is almost the same.
What if they are working? You wouldn't get them. And at the time they are closed, you also have to work or you have to sleep. So it is not easy. And the moment we create that environment by looking at it from a different perspective, making those arrangements, motivating them in different ways, promoting them quickly, we'll be able to achieve, we'll be able to stop the brain drain.
All right. Thank you, Roxanne Nelson Dapamakwa, the Member of Parliament for South Dine. Did give me a lead, and also responding to the budget statement for 2023, the Health Minister did indicate that an imminent bilateral agreement between the government of Ghana and the British government has been sealed. And according to him, this will be similar to an already existing one. I know that this one with Barbados, and it's also been stated here, for health workers who are excelling. And so it means that he said that Ghana will benefit from the little money the UK government will pass on for every single nurse that goes away. When we finish the agreement, it is likely we'll get over 10,000 or 1,000 pounds to come and support the health system in Ghana. But this is outside this arrangement. The brain drain we're talking about is outside this arrangement. We have individual agencies who are contacting these nurses. I personally know a number of them who have left within the sector over the last 6 months, some of them in a year or two. And you are saying that, he's saying that the government issued a statement just to encourage the exodus of nurses, and by so doing, it also means that they've been giving the freeway also to exploit others. But of course, they have to be incentivized. So that's a more free healthcare is almost in all hospitals, but doesn't cover all health issues. My wife just added me to her facility, and that's from Mo Ibrahim. Okay, so you've just added to what Jamaluddin has said. Now, I have this one from Prince Henry Kofodia. A government that touts industrialization sells all state-owned companies they came to meet after running them down. The future is pregnant. Proverbs chapter 29, verse 2. And then you say it's not outside. It's a policy that encourages the exodus. So why complain now? That's a question you're posing to all of us. All right.